Morning, this is Dr. Alex Eson. I've been a medical oncologist, hematologist, internal medicine doctor for over, 20 years. Uh, could a vaccine prevent colon cancer? That was the question I had from one of my patients. And what if I told you that one day, instead of waiting to find colon cancer, we might be able to teach your immune system to stop some colon cancers before they ever develop? That sounds almost unbelievable, but this is actually being studied right now, and I want to explain what scientists are doing, who this may who this may help, and very importantly, what we still do not know. That's important. Um, First, this is not a vaccine that you can go to your doctor's office or CVS or a pharmacy and like CVS or Walgreens and receive today. And it's not yet a vaccine for everyone. And most exciting research right now involves people with hereditary conditions of cancer, such as Lynch syndrome, which I have treated plenty of. Uh, and what is Lynch syndrome? It's normally our cells have a system that helps repair mistakes when the DNA is copied. Think of it as a spell checker for your DNA. And people with Lynch syndrome inherit a problem with this DNA repair system. Over time, the DNA makes mistakes, the mistakes are accumulated, and that can substantially increase the risk of colon cancer and also increase the risk of several other cancers. Now, this is why people with Lynch syndrome often need colonoscopies earlier and more frequent than general population. I'm on the phone with my gastroenterologist saying, "Hey, what did you see? Did you look?" And oncologists, gastroenterologists, and everybody else who deals with this, colorectal surgeons, we are trying to find precancerous polyps before it becomes cancer. And the fascinating question is, could we train the immune system to recognize these abnormal cells before they have the opportunity to become dangerous cancers? And that's where the vaccine comes in. When cells with defective DNA repair accumulate mutations, they can produce abnormal proteins. These abnormal proteins can act like flags, and scientists can basically uh, look at these, and now we have what are called neoantigens, which is the term we use to describe these. So think about it as your defense mechanism or your immune system can potentially recognize these flags and consider them or pick them up as abnormal. So if you see cells that are carrying these abnormal signals, you tell your immune system, or your own immune system will kind of know, attack them, get rid of them. We don't need colon cancer or colorectal cancer or uterine cancer. One experimental vaccine you may hear about is called NUS 209. That's N as Nancy, OUS as Sam, dash 209. It's being studied specifically in people with Lynch syndrome rather than waiting until someone develops advanced cancer and then try to stimulate the immune system to attack it, which is a different concept. Uh, so now we're intercepting the process, and that's very exciting. And there are other approaches being investigated. Researchers are studying different vaccine technologies and different combinations, and these are designed to generate immune responses against abnormal cells associated with Lynch syndrome. And uh, this truly is what we would call in the future cancer immunoprevention. That is extremely exciting for folks like me, knowing I'll see probably 25 patients today with cancer. So instead of asking, how do I treat cancer? Uh, I'll be asking, can the immune system help me prevent this cancer? So I don't have to put my patients through surgery, radiation, chemotherapy. Now, the most important part is that vaccines are experimental. We do not yet know whether they will ultimately prevent colon cancer. We need larger studies and longer follow ups. We ought to, because we're all scared of vaccines that may harm us. And even if these vaccines prove successful, please hear me, that does not mean people with Lynch syndrome or patients over the age of 45 stop getting colonoscopies. Therefore, go do your colonoscopy tomorrow. Take the medicine, clean yourself out, and go get it done. If you have a strong family history of colon cancer, especially at younger ages, that's important. Everybody can remember the name Lynch. It's not that complicated. There's nothing wrong with asking your doctors about it. The vaccine is truly the future. The screening of colonoscopy, endoscopy is today. So, where are we heading? For decades and decades, I've been doing this. Gosh, 95, I started med school, and I'm old. So we're very excited. The surgeons, the radiation doctors, the oncologists, the immunotherapists, we're all really jumping up with joy, hoping that at some point we have something that we can give you to keep you from having to go through misery. But for families affected by Lynch syndrome, as well as anyone over the age 45 or anyone with symptoms, please go get your colonoscopy and endoscopy. Really, my goal personally is to take complicated medicine understandable. I've always had a hard time understanding things myself, and so I have had to dumb it down for me. And so once I get it, then I don't forget it. So if you know someone with Lynch syndrome, strong family history of colon cancer at a young age, please share this video with them. The research is extremely promising. The vaccine is experimental, and you do need your colonoscopy. And again, if you're my patient, hopefully I'll see you this week, and I can take care of you. And if you're not my patient, please follow up with your doctors and listen to them. And I hope you never have to see me with cancer, which would be good news for definitely you and I. Have a wonderful rest of your day.